Hi, I'm Mark Newman, the president and founder of Precision Analytical, and I'm going to give you a little tour of the Dutch report to help you understand the report. We've got a video here to walk you through it, and we've got subsequent videos that you can watch that will go into more detail about the different parts of the test itself. You'll find on the report that on page 1, you've got an overview of the hormone levels. So you can see there the total of the estrogens, the progesterone, the testosterone, the total of the DHEA production. And then for the cortisol, we've got a pretty complex analysis. So we start here on the summary page with the free cortisol at different time points. Keep in mind that first time point is a waking sample. The waking sample tells you how much cortisol you've had throughout the night, and then the morning sample is collected 2 hours after waking up and gives you the initial surge of cortisol as you wake up for the day. There's typically an increase in cortisol, and you can see those levels in that second point. Then there's another point later in the day, and then one at bedtime. So we're going to add those up, and you can see the total there on the report. That tells you the free circulating cortisol. Then you can see further to the right, metabolized cortisol. This is really your better marker for the overall production of cortisol. So the free cortisol tells you what's circulating at different time points, and then the production tells you the overall production of cortisol in that metabolized cortisol measurement. Moving on to page 2, pages 2 and 4 are simply a listing of the hormones with their ranges and whether they're within range or not. Most of these values are replicated then on the graphical pages, in particular page 3 and 5 that have the more detailed breakdown. So moving on to page 3, you can see the reproductive hormones and their metabolites. So as we look at progesterone, you can see that progesterone has 2 metabolites. The reason there's no value there for progesterone is progesterone doesn't end up in urine until it's metabolized. So it's an indirect measurement. Now we've shown that both of these markers, beta-pregnenolone and alpha-pregnenolone, correlate very well to serum progesterone. So we list them both. And then what you see on the summary page is from taking these values, we're actually able to calculate for you a serum equivalent value. And the way that we're going to show those is we're going to show them relative to both the premenopausal and the postmenopausal range. So you can see a premenopausal range up higher between the 2 stars on this gauge that acts a little bit like a speedometer in terms of trying to figure out where your results are relative to a normal premenopausal woman. If you're not cycling, if you're postmenopausal, then the expected values are going to be down in that little purple band that's on the bottom part of the result gauge there. So you can see the postmenopausal range and the premenopausal range for all of the estrogens as well as the progesterone metabolites. So as you move to the estrogen metabolites, you can see a pretty extensive look at the estrogen metabolites. The first thing we want to look at is the overall levels of those estrogens, and then we can also see the metabolism of estrogen. And you can see subsequent videos that should be available for a more detailed breakdown of how to interpret those results appropriately. So as we look at the androgens, we can look at DHEA and testosterone. Now, DHEA actually has 3 different markers. You've got DHEA-S, which stands for DHEA sulfate, as well as etiocalanolone and androsterone. Those last 2 are the 2 most abundant metabolites of DHEA. So to get the best idea of overall production, what we simply do is add those 3 up. And you can look at those relative to one broad range, or you can also look at those relative to the range that you find yourself in with respect to age. So on page 5, you'll see very detailed information about cortisol, both the free pattern, which we want to assess for dysfunction, and then also checking the cortisone, as well as the total of the cortisol production as assessed by metabolized cortisol, the total of the metabolites, and then looking for any metabolic preference that may also be relevant. So on the summary page, we're going to get a snapshot of all of the information, and then you can dive in more detail. For both patients and healthcare providers, we have additional educational videos available on the website and also embedded into the report that will help you to understand the different subsections of the report. For patients, if you have questions, please do see your healthcare provider. And for providers, if you have questions on the report, please do reach out to us. We have a team of clinical consultants that can help you understand those results, and we look forward to continuing to work with you.